Onc Live Insights is a video editorial program produced by Onc Live.
There's still a lot of challenges for the treatment and prevention of CINV, particularly in the delayed phase. We know that this is the area where we have the least amount of data as far as complete prevention of delayed nausea and vomiting. We are working with new agents and new combination of agents to make sure that we target at least the known neurotransmitters and mechanisms of CINV. But even with that, we know that delayed nausea particularly is still undertreated. Part of this is a compliance issue, an adherence issue from a patient standpoint, that they may not be taking their oral medication that are given post-chemotherapy in the home setting. Part of this is a lack of reporting. Patients oftentimes feel like they don't want to bother their physician or bother the nurse, and therefore they don't call the clinic and they kind of want to tough it out per se. We also know that there are probably other pathways in a need for newer agents and combination of agents that are needed going forward. We also have a lack of data in the area of multi-day chemotherapy. Most of the data that's out there and most of the studies that are done really are done on single-day chemotherapy regimens or a combination of agents. And when we look at multi-day agents, such as 5 days of cisplatin, that we know is a major problem, there's a lack of data, and really from a healthcare provider standpoint, sometimes we're not quite certain what to do. We do what we think's right, but we don't have a lot of randomized trials to make sure that we're doing the best for the patients. Adherence from an oral standpoint is, again, a very important problem. We know that a lot of the antiemetics that are being brought to market today are of the oral variety, and we know when they come in clinic and we give them an IV antiemetic, we know they get it. Unfortunately, sometimes we don't know that when they take their oral medication at home, whether we're getting it or not, and that's why it's important for the follow-up and that we make calls to patients and make sure they're adhering to their oral antiemetic regimen. The other important problem that we need some more data is with breakthrough nausea and vomiting. As I said, particularly on the nausea side, as I said, we have done a wonderful job over the years of almost preventing emetic episodes, particularly with high-risk agents such as cisplatin, with the now combination of agents that are available. However, we still have about a 10% breakthrough rate in that population, and oftentimes these patients are very difficult to treat with subsequent cycles of chemotherapy. And we're hoping with the newer agents and combination agents that we can do a better job in this kind of relapse refractory patient population.